Medical experts have attributed the surge in non-communicable diseases including hypertension, cardiovascular diseases and stroke to the alarming levels of salt consumption among Nigerians. The Network for Health Equity and Development, Corporate Accountability for Public Participation Africa, and the Global Health Advocacy Incubator have jointly initiated a nationwide campaign advocating for a reduction in salt intake. In a briefing on health diets, technical advisor at the Global Health Advocacy Incubator, Dr. Jerome Mafeni, emphasized the pressing public health concern posed by excessive salt consumption in Nigeria.
Because the high salt intake is linked to high blood pressure, which is linked to heart disease, which is linked to kidney disease, which is linked to other diseases. Cardiovascular diseases are responsible for a significant amount and significant number of premature deaths, deaths in young persons and disabilities in Nigeria. When I was growing up as a child, people who had stroke were usually old people. Now we see people in their 20s and 30s and early 40s having stroke, becoming impaired because of stroke and dying early.
Addressing the issue of set salt targets to expand access to healthy foods, Executive Director of CAPA, Mr. Akimbode Oluwafemi, highlighted the infiltration of processed foods and sodium-laden seasonings into the local market. He expressed concern over the nutritional transition in the country caused by the proliferation of unhealthy fast food outlets, posing a substantial risk to public health.
So worthy of note that while we are also, trying to educate Nigerians, is to also say we need to be aware of the tactics of the industry to get us completely hooked on these products. We noticed since we entered December the escalation of promotion by some of the sodium manufacturers in Nigeria, because they know you are going to cook, and so some of them even started organizing food festivals. I have seen quite a number of even adverts, and these days online adverts that were promoting some of these products. Almost all of them, I'm using almost all of them, already had salt in them. We need to begin to unlearn certain things that we learned about our diet.
Calling for urgent action, the civil society organization urged policymakers at all levels to expedite the development of regulations on salt intake. They emphasized the need for the Federal Ministry of Health and Social Welfare and the National Agency for Food and Drugs Administration and Control, NAFDAC, to formulate and enforce robust healthy food policies goals to safeguard citizens from detrimental effects of high salt intake.